Hello everyone, my name is Anthony and thank you for joining me for another two-part virtual lunch and learn. This week we'll be discussing two common areas for joint pain, the shoulder and the low back, both of which can be prevented. We want to mention that this information is intended for educational purposes and should not be interpreted as medical or financial advice. Here in part one, we'll be starting off with shoulder care and we hope you enjoy. Let's start off by testing your knowledge. How many different bones make up the primary shoulder joint? The answer? 3 bones. The 3 bones include the humerus, or the upper arm, the scapula, which is your shoulder blade, as well as the clavicle, or your collarbone. The top part of the upper arm bone has a ball that fits into the socket in the shoulder blade, forming a ball and socket joint. These bones are surrounded by many muscles and tendons that hold them in place, which are known as the rotator cuff. The shoulder is the most vulnerable joint in the body. While the shoulder is the most mobile joint in the human body, its ability to move in so many ways also makes it prone to injury. It's also connected to the back and the neck. That's why it's so important to maintain your strength for the stability of the joint. Most shoulder problems are linked to the soft tissues, which are your tendons, ligaments, and muscles within the shoulder. There are several things that can cause shoulder problems. There are overuse or repetitive motion injuries, which is using the joint too much or doing the same movements over and over again. Injuries from using poor positioning or posture. For example, this could happen in work movements, at play, or even during activities such as cleaning the house or doing yard work. There's trauma, such as falls, sports injuries, fractures, etc., that affect the shoulder, especially when stretching out the arms to break a fall, as well as arthritis and other health conditions that cause degenerations of the tissues within the joint. Many shoulder problems affect the soft tissues, again, the muscles and the tendons around the shoulder joints. Examples include bursitis, which is inflammation or swelling of fluid-filled sacs that cushion the joints, tendinitis, inflammation in the tendons that connect the muscles and the bones, as well as rotator cuff injuries. Dislocation can happen when the bones are either partially or completely out of the socket, and may happen more often if the soft tissues in the shoulder are loose or torn. Dislocations may happen suddenly or from overuse of the joint. There are several things you can do to help prevent shoulder injuries. First, listen to your body. Don't overdo it, whether that's in a sport, lifting weights, lifting any objects, or in everyday activities or job tasks. If you feel pain, stop. Also, warm up before physical activities to get your muscles ready to move and to reduce the risk of injury. This includes not only exercise, but any physical activity, such as cleaning the house, gardening, work, job-related tasks, etc. Be more active on a regular basis and add more activity time and intensity gradually. For example, learn how to lift weights correctly and don't add too much weight too soon. Not sure how to get started? Feel free to ask us at the Place for Wellness how we can help. Next, use proper posture. Be aware of your posture during all activities. Finally, learn and use proper form when exercising, including strengthening, stretching, cardio, yoga, Pilates, etc. All forms of exercise. As we've spoken about in previous lunch and learns, it's important to remember your reach zone when planning your work and tasks. As much as possible, keep tasks in the ideal reach zone as noted by the green shading on the slide. And if you perform overhead work, be sure to take frequent breaks. This will help to reduce the stress on your neck, back, shoulders, and arms by keeping that work close to the body and within that range. We want to remind you that when you're doing these stretches, if you feel discomfort or pain, you should complete the stretch more gently or discuss this with your injury prevention team or your medical professional. Biomechanics are especially important for preventing shoulder problems, and some simple shoulder exercises and stretches can help, such as the shoulder blade squeeze or the scapular retraction. You stand tall with an upright posture, placing your feet about shoulder widths apart. Pull your elbows backwards and squeeze your shoulder blades together. If you experience discomfort, perform the movement more gently. The standing chest rest. Stand in a corner or a doorway and place hands, forearms, and elbows on the walls or door frame. Place one foot in front of you and gently shift your weight through your arms and onto your front foot. You should feel a mild pulling sensation across the front of your chest and shoulder. If you experience discomfort, then perform the movement more gently. The seated thoracic extension stretch. Sit upright in a chair that has a backrest that ends at your mid-back. Place a tightly rolled towel at the top of the backrest. Interlock your fingers behind your neck and pull your elbows back. Slowly extend over the back of your chair using the towel roll as your pivot point. Allow your chest to expand while you're breathing as you lean backwards. You should feel a mild pulling sensation across the front of your chest and shoulders. If you experience discomfort, perform the movement more gently. If you ever would like any more stretches or exercises for your shoulder pain, we at the Place for Wellness would love to help you out. It's also important to remember that your medical health professional is a great resource. There are some warning signs about shoulder problems that mean it is important to seek medical care. A significant increase in stiffness or a decrease in the range of motion in your shoulder, a feeling of instability, such as a feeling that your shoulder may pop out of the joint, numbness or tingling in your shoulder or arm, a significant decrease in shoulder strength that limits your daily activities, as well as pain in the shoulder, neck, or arm. Pain in the arm and shoulder with certain other symptoms can be a sign of a heart attack. Some start suddenly and are intense, but many others also start with milder discomfort. Other symptoms include chest discomfort, pressure, squeezing, fullness, pain, upper body pain, one or both arms, jaw, back, or neck, as well as shortness of breath, nausea, lightheadedness, or breaking into a cold sweat. If you experience these symptoms, call 911 immediately. What will you do next? Here are some possible next steps to keep your shoulders healthy. Ask about an ergonomic assessment or job site work analysis to help you learn proper movements in your daily work. Try a simple shoulder stretch, such as the ones we include today, or talk with an injury prevention or a qualified fitness professional. We hope you enjoyed part 1 of today's presentation regarding shoulder care and that you were able to take away some valuable information. We look forward to seeing you back in part 2, where we'll be discussing low back care. As always, if you ever have any questions about your health and fitness journey, we at the Place for Wellness would be happy to have a conversation with you. Thank you.